Welcome back to Elfie Voices. I'm your host, Ayal Gohari. Today's episode, we explore how diabetes can shape identity, how community can rebuild confidence, and how sharing real stories helps dismantle stigma. Whether you're living with a chronic condition, supporting someone who is, or working in health, this conversation highlights why patient voices matter, not only for understanding disease and navigating everyday health, but for showing and shaping how businesses and the wider healthcare industry innovate, design, and truly serve people. Joining us is Eman El-Menshawy, a diabetes advocate with over 30 years of lived experience and a voice that has shaped communities across the MENA region. She's the founder of Eman Diabetic Diaries, the first Arabic platform dedicated to chronic disease awareness, created to ensure people living with diabetes are never alone. An international advocate, a certified educator, Eman brings real-world insight into daily management, patient trust, and long-term engagement, offering healthcare leaders, pharma, and insurers a clear reminder that the most effective solutions are built with patient experience. Thank you so much for joining us, Eman.
Thank you, Aya, for having me. Thank you, Alfie, for having me.
We're so excited to have you and hear more about everything that you've experienced and witnessed firsthand and as an advocate and educator, especially with something as demanding as diabetes. So tell me a little bit. You've been a strong patient advocate for years. What do you think is the main reason why there's a distance between what people see and the community and real life patients and the industry in general?
Well, I would say for several reasons, mainly because there is no capacity, if I may say, like everyday realities versus healthcare settings that are usually focuses on symptoms, results, and etc. have no enough time to actually check in with the patient and other important factors as well, like the messy and emotional and practical realities, fatigue, financial strains, what I suffer on daily basis with a chronic disease. And not to
Mm-hmm.
mention also that it's a short time. The appointment with the doctor is very short to have the capacity or even the luxury to communicate more and more and more, which is very important, to be perfectly honest. And that's why there is an entire team that takes care of someone who lives with diabetes, or I think generally speaking with a chronic disease, and it consists of four professional team members to tackle all factors in someone's life for him or her to live a normal life as much
Oh,
as possible.
so speaking of this idea or this message, what would be the most important message you felt that you feel patients don't feel that they are heard of? What message in particular? I'm sure there are many.
But let me start with one general yet very important one. Patient are more, I want to be seen. I'm not my diagnosis. I would love them to see me as a whole person. I mean, patient want decision makers and the doctors even to understand that quality of life is affected, is negatively affected
Mhm.
by living with a chronic disease. The daily functioning and the emotional well being, it matters as much as the lab results. Even the communication and my relationship with people around me is impacted. So
Mhm.
I would rather, and my message would be to see me as a whole person, not only a diagnosis.
That's fair. That's fair. So, how do you feel digital tools play into that narrative or in providing in that gap or that bridge?
Well, I think they do shift priorities. I mean, care tools become more user friendly, accessible, and relevant to real life, my real life.
Hmm.
And whatever the policy is and
Hmm.
program, they are affected by actual needs like flexible scheduling, mental health support, or
Hmm.
even the financial assistance or the moral assistance that can be available for people.
Hmm.
Patient input often is not seen, unfortunately, and it's important, and it actually sparks innovation as well. It helps the industry to come up with new ideas, new innovation to help sell their products and support the community of people living with diabetes or, generally speaking, with any chronic disease.
Nice. That's such a really great way of putting it because what use is it if I create a medicine or some sort of treatment that isn't applicable to real life? And I guess you're absolutely correct with how digital tools are more flexible and they're able to fit into the tiny cracks of our daily routine. And that's how we slowly get into the idea of, oh, a patient is a real person and what it is that they need, and so on and so forth. So, from your point of view and from your community, why do you think this kind of clarity makes such a difference for someone living with diabetes? The clarity of a real life and not just a diagnosis in terms of the patient's treatment plan or their diagnosis or their chronic health journey and as a whole.
It is relevant to the fact that it became, instead of compliance, it's collaboration. Because
Mm-hmm.
then through the tools, I can put more effort, I can be more consistent, it's much easier. And then the healthcare system can actually read that thoroughly. And
Mm-hmm.
then it starts to be a collaboration relationship, and not only compliance, also language matters.
Mm-hmm.
All those factors do affect in people living with diabetes or any chronic disease willingness to abide.
Yes.
It has a mental of course, a hurdle, and also I want to say another word. It has a toll on us, and
Mm-hmm.
it's not seen. And that's why it's important to have this kind of daily kind of support, even if it's not available in the short time or in the short appointments. It is important, and this would offer, and having this kind of consideration would offer those type of relationship to be built.
Mm-hmm. Speaking of the emotional toll and the mental toll that it takes, of course, we were talking a bit earlier as well about how language itself also was an impact in terms of even choosing the term or a fun term, making it interesting. Elfie already does that. We do work on the gamification and the rewards part so that we have a little bit of a human factor to build a more consistent habits, and that's how we thought about it, the human, right?
Yeah.
So a different aspect is the language. Tell me a little bit more about that because I loved that story that you mentioned with your community.
There are actually initiatives been launched abroad. It is related to the fact that language matter. When doctors talk to me with some sort of, well, I won't say a dominant kind of voice, a dominant kind of, they know better, and I do understand that scientifically. But there are aspects they do not see, they cannot see, and they actually would prevent me, or at least make me feel a little bit well, I won't say shameful, but uh, would prevent ease of communication,
Mhm.
because language matter. If I'm always meeting my doctor, and he would, or she would tell me that I'm not compliant, that I'm not doing enough effort, that 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 would make me feel my shortcomings and see
Yes.
them. And
Discouraging,
it's
yes.
impossible. Listen, it's impossible to be perfect with a chronic
Mhm.
disease. There
Mhm.
are
That's
so
true.
many aspects. In living with diabetes, there are more than 40 aspects that would fluctuate my
Mm.
BG. BG is my blood glucose levels.
Yes.
And it has nothing to do with what I eat. It might be what I eat, type of what the food that I'm consuming, the
Mhm.
temperature around me, the
Mhm.
nervous or the anxiousness that I'm exposed
Feeling,
to.
yeah.
So
Mhm.
it's very hard to be perfect.
I
And
totally agree, yeah.
we shouldn't be, even the healthcare providers, I don't think they should be seeking perfection, but seeking empathy and kindness, because this is how um, patient actually comply.
Mhm. And how they're able to maintain, I think, a longer term of consistency as well because they don't feel pressured to by looking only at the negatives. I think that's been the whole identity of your community and your voice. You always deliver things in such a warm, clear, and a humane way that makes everything so relevant. So
Oh,
let's
thank you
talk.
for saying that. Yeah,
No,
yeah,
it's
means a
true.
lot.
It's
It means
true.
a
I've
lot.
seen a lot of your reels and a lot of your videos, and the one thing that I found that was just incredibly heart touching, even though I'm not a person of diabetes, I did sense a sort of like, oh, it's like it's not hard for me to be able not to beat myself up every day. I can actually do something without feeling guilty, and
Yeah.
it's beautiful that you provide a lot of how to or guides that work around it. You're not just like, you're not doing this right, or if this happens, it's the end of the world. You also follow up with practical tips. All right, if it does happen, let's make sure we do this and this and this. So, this brings me to my next point about education and content, right? So, education, and like you mentioned earlier with the idea of collaboration between the patient and the healthcare provider, there should be a sense of education, there should be content, there should be something that is provided. So, I wanted to know about your idea. What's the main educational gap that you feel needs to be addressed to help people feel more confident and supported, education wise?
Can you allow me to say one thing? Because
Mm-hmm.
usually education is about information, and in this context, doesn't apply. To
Mm-hmm.
me, education is about empathy, it's about empowerment, it's about connection and context.
Mm-hmm.
You've mentioned it briefly. Education is not only about information. It is important. However, relevance also is important. People
Mm-hmm.
would change, and behavioral change is so important and takes a lot of
Mm-hmm.
time and effort for people to actually communicate their struggles, their fears. They don't understand.
Mm-hmm.
Also, that there are so many aspects that get affected and negatively affected, if I may say, by
Mm-hmm.
being diagnosed.
Mm-hmm.
Even personality traits would change over time before diagnosis and after diagnosis. So that's why I always say, like, education is not only about information,
Mm-hmm.
but it's more and goes beyond that. It's about context, empowerment, and empathy.
Nice. That's great, actually. And I'm sure that the idea of the emotional barrier and the individuality of the cases from one person to another also kind of affects the idea of what content to provide as well, because I'm going to go back to the idea of how you've built this community and you're trying to provide a space where it's humane and warm and empowering. And I still feel like the information you give in your reels is still information. Like, there's still a lot of educational points that you mentioned, although we know that the chronic user doesn't really need more information. But I'm sure there are little gaps or areas where you feel like they aren't spoken about enough in terms of education for the patient themselves, right?
Well, yes, definitely the part that mainly the emotional part. There are a lot of facts. Oh, thing is, maybe I look at education differently because
Mm-hmm.
education to me is important to change behavior, and facts don't do that all by themselves.
Yes.
And it's important for people
Mm-hmm.
living with diabetes and chronic disease in general to change their behavior and
Mm-hmm.
lifestyle.
Nice.
Education is important, information and facts are important, and that's what I try to provide online.
Mm-hmm.
But I guess also the way I'm communicating that is, as you mentioned, is warm and genuine and actually authentic. And
Mm-hmm.
that's why it reaches to people, it's relevant to them.
Yes.
Doctors may say the same exact information, but
Mm-hmm.
it might not reach and get, like, have the same impact as
Mm-hmm.
it's delivered with kindness and with empathy. The
Mm-hmm.
information that I say is not really, generally
New?
speaking, it's not really communicated in the clinics.
Yes. Oh, it's not new, the information that you're giving
It's
to
not
the.
you exactly. It's not new.
Mm-hmm.
However, I blame a little bit our community in Egypt or like in the Arab world. We are not so much into reading, and that's one of the hurdles. That's why we're not exposed to the right information or to the information in general. So I would translate my knowledge, and because I studied, and because also I came from a background of like all my family members are doctors, so
Mm-hmm.
I had the knowledge, I had the understanding, and I studied. So I started to translate that in a way that would resonates with others.
Mm-hmm.
Information like what to eat, timing matters when it comes to diabetes. It's not always your fault. Many factors or many things are way out of your control, and it's okay. And it's important that you maintain a healthy mental health so you can actually control your diabetes because they are interlinked.
Mm-hmm.
And all those aspects are rarely tackled.
Mhm.
Not blaming anyone, but
Yeah,
I
yeah.
understand because I didn't have that.
Mhm.
First, when I was diagnosed, although I was diagnosed very young, I didn't even have the tools or the knowledge of how to find my way around the rich information, or
Mhm.
it's not a rich information. I would say it's like overloaded in kind of information online right now. It
Mhm.
has to be trusted, it has to be genuine, it has to be true, and it has
Yes.
to be personalized.
Mhm,
So even
mhm.
my broadcasting of information, I always try to say that it's not personalized. You have to consult with your doctor, the one who actually follow up on your case. But you need to be an educated patient. You
Yes.
go and ask and you argue to understand, not for the sake of argument.
Mhm, mhm.
That's
And
it.
despite it being really hard with the whole lab tests and the numbers and your test results and, "Oh, no, what happened with this? Is it good? Is it bad?" And like you mentioned, the clinics have a specific way of delivering these numbers purely kind of statistically in a way,
Yes.
which isn't
Yes.
very fun, and I think that's what, kind of Elfie is for, and this is why we have such a great, collaboration and relationship because we really understand the idea of a human, right? Speaking
Yeah.
of humans, we were told during our like presentation days that humans are programmed to respond to storytelling. So,
Yeah.
what's your take on that? Do you feel that storytelling helps people take ownership of their care? Does it improve self confidence?
I would say definitely.
Hmm.
Also people like stories. We all
Ah.
like stories. We all like hearing them. But it's particularly important when it comes to sharing vulnerabilities, sharing
Hmm.
something that is relevant to me, but I'm not sure if it's shared, or I'm not sure if it's only me, or it's very
Hmm.
empowering to see someone else who goes through it, and I see them as, well, they look healthy, they look good, they are online, they are positive, and that gives sense of safety as well, which is very
Hmm.
important, and
Yes.
relevance.
The
We
trust, I
all
think.
and trust. Community is very important, and
Hmm.
community is built when you see something that is relevant to you
Hmm.
in a
Hmm.
person.
Hmm.
And also, unfortunately, a lot of the aspects of diabetes is not really tackled,
Hmm.
especially the mental health
Hmm.
aspect. Like, I would have a lot of parents would say, "Thank you for sharing this information," even when I'm
Oh.
having an information is not only an information, but this feeling. Like,
Ah.
I would eat so much, and I would, between two things, I would regret or not regret, and then
Yeah.
I remind myself, and I would record that, and I say, "I'm not regretting that. I just accepted that, and I tolerate myself, and I took an extra shot just to make sure that my blood sugar won't fluctuate."
Hmm.
But because this was out of my hand, because whenever my blood sugar goes low, I feel the urge of eating. And
Hmm.
I would find parents not knowing this, and they would love to know what their kids are going through. They don't know.
Hmm.
And their kids
Hmm.
even don't know. Like, because they're
Yeah.
so young to express themselves. Like a five
Hmm.
years old, a kid won't be able
Hmm.
to say what's going on or express or. And that's why it's important to share experiences. And
Hmm.
storytelling is one of the amazing, amazing tools and techniques to do that.
I totally agree. I remember also coming across several stories of other patients that you came across. Specifically, there was a beautiful little girl, and how you compared your own story to hers, and how the early diagnosis and how she had the tools that now we have, thanks to so many things like digital tools and different things. Was a beautiful little girl, and
Oh
I
yeah,
remember,
yeah, yeah, yeah. Oh, that went viral. This one
yes,
in
it was
specific went
great.
viral. Yes, yes,
It
yes.
was great. It was lovely for you to bring like real life cases so that it's not just, you know what, in my case, I was able to, you compared both your stories. So it wasn't just one story. You
Yeah.
compared both. And I think that gave people the feeling of a little bit of hope that things have changed, things have progressed. There are better tools in the making. There are different ways we're discovering these different cases and different ways we're now tackling them. And I believe because you're communicating so well through the human side and the educator side, you're bringing them both together. I believe it's a great way for more innovation to happen and for
Oh,
people to really get into it. So, for example, today we've mentioned several times the emotional aspect and how it's overlooked
yeah,
too much,
yeah.
right? I believe that there are many ways we can tackle this, but specifically, I wanted to get into the community side of it. I remember we talked a little bit about how storytelling works, but I do want to address one particular negative aspect that is also quite emotional that I believe, and I would like you to shed more light on, that community helps, which is stigma. The stigma behind diabetes and people who have diabetes. Tell me about this whole portion, if you will.
Well, there is definitely a stigma living with diabetes. It's like it seems like others would perceive it as it is our fault. The thing is, even if it's someone's fault, they were diagnosed with a disease. Stigma is not something that needs to be communicated or tolerated, to be perfectly honest. Um, but your question is about how we.
How it happens? What exactly happens with the stigma? How does it? First of all, have you ever been stigmatized by the idea that you have diabetes or that you're taking a shot? I remember a reel where you were talking about how sometimes you get shy to take your shot in public or something like that. So walk me through how going through these experiences yourself, or some of these experiences, how has it impacted your health journey?
Well, I think being different, for starters,
Mm.
especially if in the young age or very young, would make me feel without proper intervention, would make anyone feel isolated. And
Mm-hmm.
then stigma starts and shame because the stigma starts because there is a sense of shame. I'm different. There's something wrong with me. Um, and also because diabetes for whatever reason is relevant to bad habits, bad eating habits,
Mm-hmm.
obesity, and then we would be also accused of being unhealthy. That's why you brought it to yourself. Also, it is relevant to the fact that women who are not, and I keep repeating that, who do not control their diabetes and couldn't care less, or they don't abide, or they don't comply, they're neglecting their situation, would
Mm-hmm.
face a lot of challenges when it comes to getting pregnant. But
Mm-hmm.
all of that is funny because it's related to a fact, yet is misinterpreted as miscommunicated and it's not the actual fact. It has a scientific reason, yes,
Mm-hmm.
but the community has changed it into
Mm-hmm.
something very general without
Mm-hmm.
real knowledge. I
Without context,
personally
yes.
faced that because I felt once I was diagnosed, I felt different, and I didn't want anyone to know, despite the fact that also my folks and everyone in my family are doctors and that they would understand, but
Mm-hmm.
also I was empowered, or they listened to the fact that I don't want anyone to share, and I always say you should
Mm-hmm.
help the patient to overcome this feeling and actually share that they are different because we all are, but in different ways.
Mm-hmm.
And diabetes also, especially diabetes, is relevant to the opportunity of getting married. That's why you would
Mm-hmm.
find people, especially women, for so many reasons, has to do with our social dimensions in Egypt and Arab world in general, would hide their diagnosis. So they
Yes.
don't lose the opportunity of getting married or
Mm-hmm.
getting
That was the
pregnant
question I was gonna
or
ask. Yeah,
yes,
that was actually what I was going to ask you, because I remember you said even, or despite you coming from a medical background, in terms of your family and your awareness and your education, because you've read up on it, right? I wanted to ask, does the stigma, does this emotional barrier of shame and so on, has it ever caused someone to negatively impact their health journey? So they'd avoided checkups, or they would see the numbers but they would ignore it, or they would avoid trying to get help, for example. So now that you clarified on it and you've mentioned it, the community aspect can make it or break it in a chronic patient's health journey. Would you agree or disagree to the statement?
I would agree, definitely. It is. It is. It's very important, and generally speaking, not only when it comes to people living with any kind of disease, but it is
Mm-hmm.
so important in shaping our understanding and finding, even when it comes to our primitive lives,
Mm-hmm.
we cannot survive without communities. We cannot. And when it comes to dealing with a new challenge, like the
Mm-hmm.
diagnosis or diabetes or whatever,
Mhm.
community is important. An understanding one is very crucial.
Mhm.
Um, However, definitely people can, oh, I won't say can do without a community, but they can survive. It's not the
Oh.
best thing, but they can
Mhm.
survive definitely with the right information. And because a
Mhm.
lot of people would lack this kind of support, or they would want support in their own way, it takes a
Mhm.
lot to reach to acceptance. You know,
Mhm.
I always say that to accept, to ask for people to accept you, or the community to accept you, you need to accept yourself. You need to be very grounded on your
Mhm.
situation. You're
Mhm.
different, but you're not, you shouldn't be ashamed. You went through and you go through, or you might be stuck in one of the acceptance phases, because first, when we are diagnosed, we go through something that it's very hard for us or challenging. We
Mhm.
first deny it, then we negotiate about it, like type, okay, I don't want to take the shots, can I eat as much as I want? Then
Mhm.
we're angry. That's the third stage, anger,
Mhm.
depression, and finally acceptance. So it takes a lot. And not only the patient himself or herself, but also those who are involved around him, the parents, the loved
Mhm.
ones, the partners. Community is very important, but um, I don't want to throw everything on the community per se. I would
Yes.
I would rather see patient well educated, empowered, know their value, don't
Mhm.
feel ashamed by diabetes, and that then they would enforce um, others to accept them because they accept themselves. Community is important, no
Ooh.
deny, and I always
Mhm.
say, and still
Yes.
it's important, but it's not like I go to any community and you have to accept me, you have to accept me, you have to accept me. It doesn't work that
Mhm.
like that.
Mhm. Mhm. That's completely fair. I feel like the aspect that Elfie plays with this in terms of our feature called Humans of Elfie, what we did is we provided a platform for our users to share their own stories and their own experiences throughout it. And I feel like you mentioned, the idea of me being there for myself, I think that happens after I've seen someone stand up for themselves as well. And I believe that's how you've built your own community as a whole, where you're like, it's safe, it's okay, it's totally doable because you've done this yourself firsthand. Because, correct me if I'm wrong, I feel like one of the best ways to empower someone is to show them that it can be done. So when they see it, they feel like, oh, they did it. They did it. Maybe it's a safe space for me to do it too.
Yeah.
Have you felt that with any of your own community or your own followers and following?
Oh, yes, yes, I agree completely to what you're saying. Also, I would like to add to what you're saying, Yaya, that also, like a Alfie application, would
Mm.
it gives the opportunity for me or an other patients to be seen, to be
Mm.
heard. They matter. And I try to do that through my platform, different platforms, whether Facebook, Instagram, and whatever. For example, I ask parents to share their kids' pictures while going to the
Hmm.
school, while wearing the sensor or whatever. Being heard and seen is very important, and I'm grateful you guys are doing that through Human of Alfie. It matters a lot.
We're so happy that we're able to hear that from you, honestly. So to wrap this up, what would your final statement be to the healthcare industry that you want them to understand regarding the community that you've built and the journey of diabetic patients and chronic disease patients in general? What would you really like the healthcare industry to hear?
But that's a huge
A lot, right?
responsibility.
I was
It's
like,
a
I have so
huge
many. Hold on.
huge pressure. Well, I would say the same message. Um, we're more than diagnoses. We're human beings, and it doesn't only affect me, but also affect my circle. And
Hmm.
that's why there are support systems to people living with diabetes and their caregivers, which is important because they need to understand how to deal with me. I need to understand how I deal myself, and that doesn't translate only into test results and labs, and it translates into more than that:
Hmm.
well-being, mental health, and more. And I'm sure doctors and the care providers know way than I am when it comes to this. It's not only one aspect.
Hmm. You're absolutely right. The idea is, again, to find the results that we all want, which is an easier, better, more healthier journey for the chronic disease patient. And to achieve that, we really do need to take into consideration the small bits and pieces and cracks. And specifically, one really big one is the emotional factor that you've mentioned throughout our
Yes.
talk today. Thank you
Yes.
so much for your honesty, your courage, and your big heart.
Thank you for having
Your
me, A and Alfie. Means a lot. Thank you for giving me the opportunity to express myself even better through a long, not long enough, but podcast. But thank you so much for having me.
We are so proud of you, specifically as an Arab woman myself. I'm so happy of you and proud
Yay!
of you for your platform, your voice, your knowledge, and the community that you're building, and making sure that no matter what your background is, no matter where you come from, there's always a way. There's always a way to understand more, to grow, to be better, right? In every form, emotionally,
Yes.
educationally, and of course, health wise.
Yes.
So thank you so much for your time. You have been amazing, and it's been such an honor.
Thank you so much. My pleasure.
To those living with chronic conditions, you are not alone. Your experience and story are what truly drive progress. To our partners and industry colleagues listening, these stories guide meaningful innovation. At Elfie, we transform real world experiences into actionable insights that help enhance care, engagement, and outcomes at scale. Together, we can make health management simpler, smarter, and more human. Take care, stay Elfie.